I had what I consider the worst night of my life. Probably 15 years, I would either be not alive or I would be in a pretty severe state of poor health. If you stay with it and give it a chance, there's a good prognosis. Now I feel wonderful. A high functioning autistic child, he's verbal, but he's not 100% functional to the point of independence. We're hopeful that the stem cell treatments will help his body make that last step so that he will be able to be independent. My wife has been impressed with every staff member of the medical nursing staff. She has had nothing negative to say about their knowledge. If you do your research, you will see that the facility has had good results for a lot of people. I didn't research other places. My wife found it. I looked, I said, look, the results are good. I'm not going to go around and try and worry about different clinics because I don't know what the results may be anywhere, but I have a good feeling about this.
Good afternoon, Will. Would you please tell us where you come from and what brought you to Swiss Medica?
We come from the United States of America, a small rural area in the state of Virginia. We come here for treatment. My son is a high-functioning autistic child. He's verbal, but he's not 100% functional to the point of independence. We're hopeful that the stem cell treatments will help his body make that last step so that he will be able to be independent. I came here for treatment for my diabetes mellitus type 2. I was diagnosed at age 29. I am now 52 years old and have had hemoglobin A1Cs as high as 12.1 before. And I have been starting to have issues with my feet and starting to have some other issues with insulin not necessarily controlling as well as we hoped. And so we said, well, let's try, because the results that we had researched seemed to be very promising. So we decided to try it for me as well. Since we've already made this trip, let's give it an attempt.
Before coming here to Belgrade, have you considered any other clinics? And if you have, what was your experience with them? Why at the end of the day you chose us?
We chose you because with testimonials, results, there was extensive online research, and I'm going to leave you with my email as well to allow people to contact me who wish to, if you wish to give that out, to where I will be willing to correspond to people about my situation more than just an interview. Of course, you never know, but we have been very satisfied since we've been here that this is a legitimate medical facility. This is not a scam. This is a hospital. These are medical professionals and they do treat. The results so far, my initial results have been very good. Hopefully we'll see how they do as the months go. Of course, stem cells, everyone's different, and they make it clear when you come here 6 months before you know really how you're doing. However, initially it has been excellent, and I hope it will continue. But as far as coming, we are followers of Jesus Christ. We believe in a higher power. We believe in God. We believe that God ultimately pointed us to come to this facility. So if you're a person of faith, although this facility does not try to encourage you can have any faith-based tradition you want. I've seen Muslims here, Christians here, people of no faith background here. Everyone's welcome. There's no discrimination at all. But we believe that our God led us here through our own due diligence. You have to do your own diligence, but we've prayed about it. And when my wife first mentioned it, I had a very peaceful feeling about it, which we as Christians, we call it the Holy Spirit. There was a very good peace about it. and then the more research that was done only compounded. I'm not aware of I'm aware maybe it's done some other places in the world. I didn't research other places. My wife found it. I looked, I said, look, the results are good. I'm not going to go around and try and worry about different clinics because I don't know what the results may be anywhere, but I have a good feeling about this. I really believe that it has a chance, and the testimonials and the research we've done and now our own experience indicates, I believe, that it was justified. And again, I would love to do another interview if possible in 6 months where we could do a here's where we are now. But initially, it's a very positive, and for someone who's watching this interview saying, are these people real? I mean, because it's an expense for me and my son. Our treatments combined were almost $40,000 US plus the plane trip and everything. That's a lot of money, and you have to. But I can tell you, there is sincerity. I can't results again. Everyone's results are different, but I can tell you there is sincerity, and this is a legitimate facility that does try to treat you, and hopefully you'll have the same results. A lot of people, if you do your research, you will see that the facility has had good results for a lot of people as a person does their own due diligence.
You have covered so many topics already. Okay, let me ask you about okay, you have mentioned about the facility. What about our medical staff? Are they up to the standard to perform these kind of treatment?
Yes, I believe they are. I believe they are. This facility has an operating theater, which my procedure involved going in and taking some of my fat tissue. Now, it's not liposuction. I'm saying that for the people watching the interview. It's not liposuction, but it's kind of similar. They take some of the fat tissues and use those to help treat my condition. And so, I mean, they have an anesthesiologist on staff. They have the operating room. The cleanliness is up to what, and my wife, she is a registered nurse in the United States. She says the cleanliness standards here are totally up to par. They are fine. And I've noticed it too. This place is clean. And so the staff, I believe they are knowledgeable. I am not a medical professional, but my wife has been impressed with every staff member of the medical nursing staff. She has had nothing negative to say about their knowledge of what they're doing, their professionalism. When you come from the United States, one thing you're going to notice is these folks know English, but it's not as good as what you know English. But keep in mind, most Americans don't speak any other languages, and these folks speak probably 4 or 5. There will be some language barriers, but it can be worked through. Sometimes you may think that the people are not necessarily sweet to you, but they are compassionate and caring, but you may not see it in that first impression. You have to be willing to get to know the folks, and then you'll understand that they do care about your outcome. The gentleman who runs the physio department, if you meet him the first time, you'll think, this man is mean. No, he's not mean. He runs a very efficient, tidy physio department and gets the work done. And sometimes the way he speaks, if you're a sensitive person, you may think, oh, he's insensitive. He's actually very caring. That's his personality. So anyone who comes, when you come here, you need to, I believe Americans are oversensitive anyway. But be patient, have a bit of a thick skin. I say that for the camera. Have a bit of a thick skin and get to know, because there is compassion. It just, doesn't come out the way that a lot of these politically correct snowflakes in the United States want it maybe to be. But let's look at the results. And and for me, right now, I'm doing very well. I had a quite severe reaction to the stem cell treatment. I had what I consider the worst night of my life after receiving them. The nurse who was on night shift came and she sponged me down to try and keep my body cool. Then they did the blood test, realized that some markers were high, immediately gave me 2 kinds of antibiotics, gave me what I needed to get better, and now I feel great. So it's a journey. And sometimes this journey it's not all walking through the park. This is a medical situation. But if you stay with it and give it the chance, once you're here, you have to really, but if you stay with it and give it a chance, there's a good prognosis. Now I feel wonderful. But 3 or 4 days ago, I felt awful. So the body, there is a reaction. So if you read someone say, I had a reaction to this, that's normal. My doctor, Dr. Anna, who I think my wife is very fond of, and I believe, I like her too, but my wife can converse medically. Dr. Anna is, she said, the fact that your body had such a reaction is a good sign. Sometimes an initial reaction that may seem negative is where the body's saying, oh, this is different. But then in my case, the initial prognosis is very good. Again, we'll see over 6 months, but right now everything's looking good. So maybe that initial reaction is not ideal, but the result may be ideal. For instance, I have a blood sugar monitor. Mm-hmm. Now, for people in America, this blood sugar scale in Europe, this is about the same as 6.2 in a European scale. So if you're a diabetic, this 122 blood sugar, and you'll notice if you're diabetic, I have not gotten above 150. Okay. This is with no medicine whatsoever. And I was taking 50 units of Lantus every day. I was taking Novolin R as needed daily. And I was taking once weekly Monjuro shots, which I did stop before coming for this treatment just because that's a kind of a strong medicine. But I was taking this medicine called Monjuro, which people in the States will recognize. So 122, this is after eating with no medicine. Again, let's see how we're doing in 6 months, but this is quite promising that my sugar did not spike, and I even ate some bread. Now, normally when a diabetic who has severe diabetes eats bread, the sugar is going to come up into this level somewhere and stay up there, and you have to take insulin to make it come down, just for example. But anyone who has had diabetes, and my son with his autism, that one probably is going to be a longer term situation to see how he turns out. In my diabetic situation, if you're struggling with diabetes, I think it's worth a shot. It's a lot of money, but then what is a person's health worth? And again, I would love to follow up in 6 months. Let's see how we continue to. And again, I'm going to leave with the folks here who are recording this. If they do decide to publish this online, which I'll sign the disclaimer so they can.
I have your email.
Okay.
Yeah.
My email will be available. And then if we can converse by email, and then if it gets to where I feel comfortable, I may even talk to you on the phone. But I'm going to give the email out publicly to anyone who wants it, and I will respond to questions that are for folks to say, here's my experience, and they can continue conversation with me as time goes on. I can say, here's how I'm doing now, here's how I'm doing now, here's how I'm doing now. Anyway, it's something that I think everyone makes their own decision, but I think it's, if you're ready to treat diabetes and you've been having trouble with your A1Cs and you're ready to make the sacrifice, because you can't take your money with you. And my situation with my diabetes was such that probably 15 years I would either be not alive or I would be in a pretty severe state of poor health. The initial results, again, we're several days in. This is a long-term deal. But the initial results indicate that I may be in a position to where now I could have a good quality of life for a longer period of time. Another thing I want to point out for the person who comes. There are cameras everywhere. Don't let that scare you. This is a medical facility. The reason there's cameras everywhere is if you have a medical emergency, hopefully they can see you're having a medical emergency and get to help you. So we, in one of our bedrooms, me and my wife and son in one of the bedrooms, we put something over the camera to cover it, which they allow you to cover the cameras. Bring like a dart bag, which has that can be tightened. You can
Or
cover
just a
the camera.
sticker.
Or a sticker or something if you want to. They allow you to cover the camera, but then you're at the risk of them not seeing you. We did not know that the cleaning staff came into our apartment at first. We didn't know, and we have had nothing go missing. We have had no theft whatsoever. The facility here is at a compound that is walled off. Now, it is outside of Belgrade, and it is we arrived in Belgrade and the money changer was closed, and I said, oh, what am I going to do? I haven't had to spend a penny other than what we just paid for our fees here. They provide food, the accommodation. You don't really have to spend any money outside of it if you don't want to. Now, we're hopeful this afternoon we may go to a church in Belgrade to see a church, but that's everyone's own choice. But there is a walled compound here with security. The cameras are here. I have never felt unsafe here. That's another thing. I'm coming to a foreign country. What's it like here? I don't know what it's like outside of the walls. I've read Serbia is a very safe country. I believe it. I mean, I get that sense.
I doubt you've read that.
Yes, I have read
In
that.
United States.
On the
We
internet.
have patients coming from United States and receiving an alert before coming to Serbia. That's why I wanted to ask you.
Okay.
From United, from Delta and United.
The United States State Department has a 4-coded country visiting metric. Level 1, completely safe. There's probably 10 countries in the world that are level 1. Level 2, exercise increased caution. Serbia is probably on the exercise increased caution. Okay. Any country you go to as an American, if you pull out your wallet and start flaunting $100 bills, here you probably could and you could get away with it. You go into Belgrade and you start pulling out your money and showing your money, you may be inviting some sort of difficulty. In the United States, if you flaunt your money, you could get robbed. And I believe in our gun rights. I love the fact we have gun rights. But in the United States, you flaunt your money, someone may have a gun. Here, there's less likelihood of a gun. But so these alerts you get, if you exercise precautions, okay? Yeah. My wife is from India. We go to India. India is also an exercise increased caution country. And there's robbery. They talk about this and that and this and that. But it's quite simple. Maintain a low profile. Don't show off your money. Don't show off. I keep this under my shirt usually. I'm showing this to give glory to God, that God led us to come here and that God gave us the financial ability. That's the only reason I'm wearing this cross exterior. Normally, this thing, it's gold. stays inside. Okay, I'm doing this for the sake of the interview. I want to give God the praise. That's why I wear it outside. But I don't know. We're hoping this afternoon to take a car. They have apps in the dining hall. You know this, but for the sake of people watching, there are apps in the dining hall that you can get a taxi and go into Belgrade if you want to. If you want to go eat out or something, even though I recommend if you're here for treatment, don't look at it as a tourism vacation. This is treatment. But then if you want to and you want to go into Belgrade for an afternoon or an evening, it's there. There's apps. You can get a cab that can take you at a very reasonable price. So I don't know what Belgrade is like. We're going to find out. But everything I've read says that Serbia is just as safe as any other country. And you look at the some index, the United Nations Human Development Index, Serbia is one of the more developed countries in the world. So now
developing.
Yes, but
Developing.
aren't we all? Any country that stops progressing starts regressing. So I'm sure that someone coming from the United States, you may see some cases of folks who are in a less advantageous economic situation, but that's anywhere you go in the world. Overall, though, what I've seen here on this facility is it seems like even, the kitchen staff, the maintenance staff, they look like they don't look like they're sick people. They look like they're healthy people. So I would imagine in this country that everyone who does not have a drug addiction and who manages their money properly will have enough to eat. I don't know the whole. I'm not an expert. I'm no expert at all about that. What I can say is, though, if you these alerts you get, life is risk. Living is risk. I don't sense danger in this country. And again, I got from the airport to the facility, but at the airport, the driver came, we got our bags, got in the vehicle. I didn't know that there was no looking around and looking and sensing, oh, there might be people here who might try. There was no sense of danger. I've been to a few countries, and sometimes you go somewhere and you in the United States more so than anywhere. Some places in the United States, I'll say, this is a little bit iffy. I think we'll not be in this. Let's not be in this neighborhood too long. Let's go somewhere else. So I don't know about these warnings people are getting. I don't see it. Now, everyone has their own story, but again, if someone says, I got robbed in Belgrade, if they leave out the fact that they went to the bar, got drunk, were flaunting their money, and were walking at 2 a.m. drunk or something like that, you might get robbed. Well, guess what? In New York City, the same thing's going to happen to you. I don't think that's something you don't hold that against Serbia. So I flew Air Serbia. Air Serbia did not give any warning. Of course, it's their country. And by the way, if you are in the United States and you're thinking of coming, you have to make your own travel plans. Air Serbia has nonstop from New York and Chicago, possibly other cities. I'm ignorant.
Planning Miami.
Okay,
or
Miami.
already maybe launched the Miami flight direct.
Yeah, maybe
yes.
it's Miami.
In Chicago,
too.
New York, you're right. Direct flights.
We flew from Chicago. We went from Virginia to Chicago for the sake of the direct flight. It's just that. So I don't have any stock in Air Serbia. I never knew Air Serbia existed until this trip. I didn't even know there was Air Serbia. I will say to anyone who is watching the video, if this makes the edit, their prices are pretty good for their flights. They're quite competitively priced. Service is good, and so it's a direct flight. If some people like to be able to get off and break their trip, but the thing is, our family likes the idea you get on the plane and get there and don't have to get off the plane and go to another plane. And so anyway, from the United States, you can get from New York, Chicago, and maybe Miami nonstop. It's seasonal. Air Serbia, I talked to one of the cabin staff. In low season, there's fewer flights. In high season, there's more flights. But that's just an option. You fly the airline, everyone flies the airline they want to, but Air Serbia will get you straight into Belgrade.
How long was your Chicago-Belgrade flight?
It was 8.5 or 9 hours, something like that.
Okay.
8.5 to 9 hours. It's not bad.
Mm-hmm.
New York would be about probably 45 minutes less. Mm-hmm. Chicago to New York is about a 3-hour flight, but then the way the earth is curved from Chicago or New York to Serbia, the difference is not going to be that much. So it's about an 8.5 to 9 hour flight.